Concussions are the big hot topic in all sports, but especially a contact sport like football. And the NFL is being very, very proactive on these things, and I think they have to be because medical legally there are, as you know, a lot of issues about this right now. Concussions, we don't grade concussions anymore. Concussion is a concussion is a concussion, because too many times the patients say, "Oh, I just had a mild concussion." Well, it's still a concussion, and a concussion is a brain injury on the membrane level. It's like, this is excitable tissue, and all of a sudden with a concussion, you make these nerves kind of excite themselves, and what essentially you're getting is the stuff that's inside the cell now is outside the cell, and you got to get it back in the cell to get better. Now, to get these ions back in, there's an active glucose pump, and so what happens is your brain is depleted of this glucose, and at the same time you have decreased blood supply. So now you got a big problem. You got a mismatch. The food's gone, I can't get more food there. In that interim time is the post-concussive time, when the people are symptomatic. And so when there's a concussion, if there are no hard neurological signs, which means you don't move kind of funny, one eye isn't dilated, no slurred speech, you feel pretty good. But if you have what's called a hard neurological sign, you got to get a CT pretty quickly. And the only purpose of a CAT scan is to see if you've got a bleed. And if there's no bleed, okay. But a negative CAT scan does not mean you don't have a concussion. The concussion is all based on the symptoms. The number one symptom for a concussion is a headache. And most concussions, 85% of concussions, get better in 7 or 10 days. It's the 15% that don't are the big concerns. In the adolescent athlete, if you get a concussion and then get a second concussion very soon thereafter, you can have a significant consequence, okay? So this second impact syndrome can be lethal. There's the mortality rate is extremely high. You could have that second concussion right in front of an emergency room and be dead before you hit the door. You don't let athletes return to play unless all the symptoms are gone, and they have to pass certain tests. Now, definitely in professional sports, all professional sports, all these athletes take tests to find out what their cognitive baseline is. And then when they get a concussion, they're given this test again, and it's compared to baseline. All right, and that tells the medical team where they are and how they're progressing. So it's something that should be used at all levels where concussions are involved.